Here's a sneak peek from one of NCLEX Bootcamp's brand new readiness tests that just launched this month. And in this question, we need to figure out which of these clients is at highest risk for having a stroke. So a stroke is going to happen usually from hypertension, because that narrows and hardens that artery and can occlude blood flow to the brain, or atrial fibrillation, where the quivering atria can form a clot that then is ejected and occludes blood flow to the brain. So how about someone's risk for those things if they play professional football? No, so they're not going to be at risk for those things. They're really going to be mostly at risk for traumatic brain injuries and concussions. Then how about someone who recently got their annual vaccine boosters? So the big problem with vaccines is really just going to be local pain at the injection site, but there's also a rare neurologic complication called Guillain-Barré syndrome, or GBS, where you can develop an autoimmune response to the vaccine or to an infection, and that causes an ascending paralysis, but it won't cause a stroke. Then having 3 antihypertensive medications prescribed. So if someone has such severe hypertension that it requires 3 blood pressure meds to control, they're going to be at pretty high risk for a stroke. But let's consider our final option. Then a college student living in a crowded dorm. So this should make you think of their risk for meningitis from exposure to the meningococcal bacteria, right? But of these, the only client who's really going to be at a high risk for stroke is someone who has this severe of hypertension, and we're correct. Great job.